And Ranking Member Dave Camp of Michigan. Representatives, good to see you. Representative Van Hollen, let me start with you. Will this bill indeed contain a surcharge on the wealthy? How much is it going to be, and do you support that?
Well, let me first point out that every American who has private health insurance is currently, today, paying about $1,200 in a tax because of the fact that other people in the system do not have health insurance. So people are paying a big tax now. In order to do health reform, we have about half savings and about half on the tax side, on the surcharge side, and the focus is on, we're talking about individuals, couples earning over $350,000. There'll be a small increase.
What size?
Well, it's going to depend on how large the savings are in the long term. So there are going to be triggers based on how much the savings is down the road.
And Congressman Camp, is that the right way to go? I mean, it seems as though taxation is the key way that we are ending up paying for a lot of these programs on the administration's docket. Is this the way to do health care?
No, this is going to be a massive tax increase, half of which will be paid by small business. We expect that as many as 2 out of 3 manufacturers could pay significantly higher taxes under this. We're in a recession. We're nearing 10% unemployment. My state of Michigan has 14% unemployment. Look, what we don't need to do is add to the cost of health care. We need to get the costs out of health care, and we have a plan to do that. And there's ways to do that in a bipartisan way. This is being jammed through so that people won't understand what's in the bill. But the tax increases, and frankly, you're going to have 2 out of 3 Americans lose their private insurance under their bill, and the employer mandate's going to put 5 million people out of work.
Well,
so
give some
there's
details,
lots of problems with this
Representative
legislation.
Camp, just give some details of the alternative proposal. And President Obama also came out quite clearly and said, if you like what you have, you can keep it.
Well, 2 out of 3 Americans are going to lose their health insurance under their plan. What we want to do is get the costs out. You never hear them talk about...
We need some specifics.
Specifics, malpractice reform. You never hear them talk about how do we get the duplication in medicine, the defensive medicine that's being practiced. We think there should be something there. Let's give small businesses and individuals the same kind of regulatory and tax incentives that big businesses have to provide health insurance. And let's do something about waste, fraud, and abuse in Medicare. That's tens of billions of dollars a year, and we need to get at that.
Representative Van Hollen, once the Bush tax cuts expire, if you add a surcharge, some of the wealthiest Americans are going to be paying 50% of their money to the U.S. government. We're going to be up there with Belgium, Denmark. Is that the smart thing to do in the middle of a recession, to get up to European levels of taxation?
A couple things. Number one, it will not get up to those levels of taxation.
Why not?
Number two, this surcharge does not take effect until the year 2011. Number three, the Congressional Budget Office, which is the independent office around here, has reached a very different conclusion that my colleague here is saying with respect to private insurers who currently offer their employees health insurance. You're not going to see 2 out of 3 people lose their private health insurance. According to CBO, the majority of people are going to keep their health insurance through the private system. The president was very clear. If you like your current insurance, you're going to get to keep it. If you don't have any, or you don't like what you got, you're going to have a choice through an exchange of private plans as well as a public option. Choice and competition will increase.
Congressman Camp, with respect to the potential tax hike, there's $787 billion in stimulus that's supposed to roll out over the next 3 years, and Chairman Van Hollen just suggested that these surcharges won't hit till 2011, right when the bulk of the stimulus is set to go into effect. Aren't we effectively neutralizing the stimulus that's on the docket right now? Again, at a period where we are unsure of how strong the economy will be even 2 years from now.
Well, you are. And those people who make investment decisions, those small businesses and those manufacturers, don't say, oh, gee, taxes are going up in 2011. They will start making decisions now for 2011. So I think it has, look, this is $1 trillion bill, well over that anywhere you slice it. It's going to add a huge level of taxation, and they're just talking about within the 10-year budget window. The long-term unfunded liabilities being created by a bill, the way this bill is going to be written, is massive and will dwarf what we are seeing in Medicare in terms of long-term unfunded liabilities.
Chairman Van Hollen, just a quick question. We noticed in a graphic that President Obama signed into law further coverage for children, but President Clinton passed the S-chip program, which covers children, many, many years ago. If you were to insure under that program kids and college students, you would get rid of about 2/3 of the uninsured in this country without doing anything more. Why not just go for the low-hanging fruit here?
Well, because you're still going to leave tens of millions of Americans uninsured, and when they're uninsured, they show up at the emergency room, and we all end up paying for it through higher premiums. So this will reduce the costs of health care for people who are out there paying right now through their premiums. Secondly, 98% of small businesses are not going to feel anything with respect to the surcharge, and 99% of American citizens are not going to feel anything with regard to the surcharge. Very high income individuals who did very well under the Bush tax cuts.
It's difficult for viewers to just hear those numbers and assume that they're true, so we can't go into the details of whether it is accurate or not. But Congressman Van Hollen, just quickly, just tell us how nervous you are about drawing the line in the sand here with August. And you talk about 2011 with the taxes kick in. That's after the election. If it doesn't happen this summer, you're pretty nervous.
Well, we have a fundamental choice to make. The country does, and we're going to be debating this bill. The question is, do you like the status quo where you have escalating premiums? Health care costs are going through the roof, both for families and under the Medicare. We're going to bankrupt the government if we continue at this pace. Or do we take a change in course? Change is always difficult, but I think the American people said in the last elections, we don't like the status quo.
Yes.
We want to take a new direction, and that's what we're going to be debating.
But Congressman Camp, very quickly, if we could, there are those who say that the president should simply focus on fixing the economy first and put aside energy reform, health care reform, and a number of other issues that are on the docket. Do you think that's what the administration should do, focus on fixing the economy exclusively?
Absolutely, and the concern is what the tax increases under this health plan will do to the economy and to jobs and to families, but also the energy taxes that just passed the House. Every family is going to pay higher rates. Everything you buy uses energy, food, clothing, and not to mention small businesses and manufacturers. So we need to do something as this unemployment rate continues to go up. Clearly the stimulus was ineffective. It didn't work, and we need to go back to basics and try to jumpstart job creators and get our economy moving.
Chairman Van Hollen, just a quick question before we go. Maybe not so quick, but I'm going to try. After the baby boomers die off, everybody keeps saying that health care and Social Security will bankrupt the country forever. After they die off, there is a baby bust where we will not have the same type of entitlement liabilities in this country that we have right now. Can't we just focus on this being a generational rather than a permanent problem for the United States?
I don't think we can afford to take that risk, because you're going to have a huge unfunded liability in the U.S. government. We already have a big debt problem. If we don't address this issue, then we're going to hurt the fundamentals of the economy, which is why the president is right. What we do in health care directly relates to the strength of the economy going forward, because we are going to go in the area of bankruptcy if we don't wring out some of the excessive health care costs in the system. On energy policy, it's a national security issue. As you know, we're exporting hundreds of billions of dollars a year overseas that we should be investing right here at home.
Thank you, gentlemen. We understand it was a very busy day in Congress, so thank you for taking the time. We appreciate it.
Thank you.